Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for checking out this video today. You're here because you have sensitive gums or bleeding gums or maybe some tooth sensitivity and just some questions as to what and why could be causing that. And I'll tell you that it's something that thousands and thousands of people deal with every year. In fact, half of adults have some level of gum irritation or bleeding gums or periodontal disease, something along those lines. And if you're 65 or older, your chances are more like 2 out of 3. And there's a number of reasons for it, but one thing you should understand is it's the most common reason for tooth loss in adults is untreated gum issues. So just because your gums are sensitive, it doesn't mean you're going to lose your teeth, but if you don't do something about it, it could be the beginning of the end where you can start to lose some teeth. Several years ago, United Concordia, which is a big medical company, they did a study and found that there is thousands of dollars saved per year when people have their gums or gum disease treated. So they found that if you have active gum disease and it's not treated, you're going to spend on average an extra $4,000 a year. If you're diabetic or pre-diabetic, you're going to spend about an extra $3,000 a year if you have a history of heart disease. Closely behind that were stroke, cerebrovascular diseases like stroke. Okay. And then you go into things like pregnancy. And another one that was actually the highest was rheumatoid arthritis. So autoimmune diseases are closely linked to gum disease. So when you combine all these things, if you have a combination of those diseases or illnesses that you're fighting with or that are common in your family history, then you could save anywhere from $4,000 to $18,000 a year in medical expenses, including pregnancy, if you have if your gum disease treated. So this is where the cost of dental care, although it's not free, is very cost effective, because by treating those things, not only are you helping your sensitive gums or sensitive smile, but you're also creating a better future for you and lower chance of medical diseases and medications associated with many common diseases that many of us suffer with. If you have some specific questions about gum disease, we have a book about this that we published not long ago and talks about reason to smile and things that adults can do, your keys to having a successful and long-lasting smile without having to make an extra trip to the dentist necessarily. So if you'd like a copy of that, please call us or email us. Our contact information below. I'm happy to share more of that with you. But something else that can help with you if you have gum disease or sensitive gums is finding out why. Some people, it's they're brushing too hard. Other people, it's they haven't had their teeth cleaned in a while. A lot of people, it's a combination of both. As our lives change, sometimes we get busy and we forget to get our regular dental checkups. Now, when you have sensitive gums, usually you have 3 options to treat them. The first one that's very common and works really well is a gum graft. And a gum graft is when you have some gums usually taken from the roof of your mouth, and it's taken from a deep layer, and then you have it grafted or inserted where your gums have receded. Right now, it sounds very sore and painful. I've actually had it done 4 times, and it's kind of sore after, but I was fully awake for it. I had some numbing. Of course, I'm a dentist, and I understand that. So I may be less apprehensive than some who don't know anything about it, but I am a wimp when it comes to dental pain or sensitivity personally. So if I was able to do it, then you can do it as well in most cases, right? And there's options like sedation available. The second one would be some bonding. So if you have receded gums and part of your roots exposed, you can have bonding, which is tooth-colored resin that's bonded to your tooth, similar to what would be done for like a veneer, and it can cover that area up and mute the sensitivity. There's pros and cons to both of those. With bonding, the recovery time is shorter, but with grafting, sometimes you'll get a better and longer result. So really you just want to talk with a dentist that understands both, preferably a biomimetic dentist, because that way you can save more of your tooth and not end up with a big bulky crown that might cause more sensitivity on your tooth. And then the third one is a desensitizer. And a desensitizer is a coating, a clear coating that is placed on your tooth. Think about it like maybe painting or staining your fence, right? So you put this coating on it to protect it from a year or a couple of years of weather. Desensitizer is much the same. So that coating goes on there, and it won't completely get rid of the problem, but it can cover up the issue, make it feel better. And there's often no numbing required. There's definitely no surgery required. And it can work really well, especially if you don't have really bad receding gums, or maybe you aren't even a candidate for grafting. So if you have some more questions about this, don't hesitate to reach out to us. Check out our other videos for other topics similar, like veneers or Invisalign, or should I do implants, or should I have my teeth bonded? Questions commonly asked, and we look forward to your questions and feedback, and we'll see you on the next video. Thanks.